heart disease is one thing, as I said, is killing 1/3 of the people every year in our population all across the country. And to a large extent, we are ourselves responsible for this menace. The reasons what our faulty lifestyle is causing is that we are actually shirking away exercise programs. We are trying to be as sedentary as possible. Most of us are working in our offices. So this is a big fact of a bad lifestyle, which is reason for increase in cholesterol and fat deposit in the arteries of the heart and high risk of heart attacks in our country. The second thing is, obviously, there's a disproportionate diet intake. Most of us are habitual of having tasty food because that is the only thing to vent our stress throughout the day. In the meetings and the meetings followed by eatings and all those things, those are very important facts which actually lead to accumulation of calories in the form of fat in the body and leading to again the deposits in the arteries causing heart attacks. The third thing is indulgence into tobacco. Chewing tobacco as well as smoking is something which is a big killer because this leads to narrowing of the arteries, spasm in the arteries and worsening of the type of cholesterol so that deposits in the arteries is higher and this leads to again high chances of heart attacks. The fourth thing is that we are in a competitive world. Today we have hardly any time to relax. The stress is mounting up, the peer pressure, the performance indices, and this is leading to huge amount of risk of stress leading to hypertensions and stress related injuries to the heart arteries and increased risk of heart attacks. Important thing is also that many of us are indulging into alcohol. Well, in limits it is fine, but excess of everything is bad. And if we are indulging to daily alcohol intake more than 60 ml, this is a bad sign because this can also, in our population, is known to have a negative effect on the heart health. The last but not the least is the fact that during our course of life, day-to-day life, we should, and today world, we are actually compromising on our sleep pattern and our relaxation activities. So these are mounting up again to the amount of stress we have and would be causing a lot of problems. So proper sleep is important. Hypertension we talk about obesity, the overweight syndrome, which unfortunately many of us consider a sign of health, is the biggest sign of ill health and obesity should be taken care of. The third thing is diabetes. Some of us have a hereditary predisposition to diabetes. This is important to understand that diabetes is a precursor for heart disease in most of us. And last but not the least, we may be genetically predisposed to develop heart disease. Specifically, if we have in our family the first degree relatives, the parents or the brothers, sisters having heart disease at a younger age group, we have almost 50% higher risk of having heart disease in that situation. And that should be actually identified, assessed, and early intervention is required in such situations. If we have incidence of early heart disease less than 40 years in females or 45 years in females, we are going to be much more vulnerable to develop heart disease as compared to a person who does not belong to such a family. So you should look at your family tree. If first degree relatives, that means parents or brothers, sisters, have heart disease, more than 2 of them, then you have almost 50% higher risk of developing heart disease and should be assessed early and intervened early so that you don't land up with heart attacks down the line in your life. It's important to understand aging is a process which is irreversible. And as we all know, when we age, certain tissues, certain organ systems of our body actually deteriorate. So does the heart system as well. So yes, age is an irreversible damaging process to the heart, and they say that each passing decade you actually double your chances of having heart disease down the line. So yes, it is, but it is unfortunately irreversible. However, we can still control our lifestyles and control the damaging effect of age on our body. Rather, they can say that you can halt or slow down the aging process, even for the heart. Sex is important thing. Females are supposedly or conceptually considered to be safe, which is a misnomer, because till the reproductive age group, their hormones, these female sex hormones, actually protect them from developing hypertension or heart disease. But this is also a common myth, because during this time they become more vulnerable to a sedentary lifestyle, bad dietary habits, obesity, which actually hurts them more during the time when they are at a stressful life after the menopause. So this is important to understand that lifestyle has to be inculcated in a good fashion in all of us, specifically females, during even the reproductive age group. Today, the science is advanced enough to even detect those 50%, as I said, who are vulnerable to develop heart disease if you belong to a family history of young heart disease persons. So not all of them, none of the people who belong to such families would have high vulnerability, because the genes also sometimes dilute themselves. But we have new developments in the form of genetic testings, which actually can be done in people who belong to such families and detect if that person is vulnerable and carrying the same genes as their parents, and they are vulnerable to develop heart disease. These people actually should rectify their lifestyle much more stringently and maybe start medications much earlier in life, so that their risk to development of heart disease is mitigated and they are going to live healthy life for a long time to come. If we can have this 5-point program, which we inculcate early in life, as early in life as possible, whenever we are aware of it, we can actually limit the chances of heart disease. The first and foremost is that we should find excuses to exercise. That is important. The second one is that we should focus on healthy nutrition rather than tasty diet, which is important to be inculcated again in our lifestyle. Third thing, there is no space to tobacco or smoking in our life, or even the drugs. Those things have to be absolutely banned from our life. Fourth thing is we should actually find time to do yoga or meditation or have some kind of relaxation. Make sure that we have a proper sleep, because this is going to be a stress buster for us and we can be more effective in performance of our day-to-day activities. Last but not the least, we should be aware of those silent killers in the form of hypertension, diabetes or high cholesterol, which we should test time to time. Specifically, if we are vulnerable, belonging to a vulnerable family, we should test them as early as 25 to 30 years. And a proper assessment of your risk can actually predict how stringently you have to look at the lifestyle measures. Signs of heart disease, unfortunately, are quite late. They are not early signs of heart disease, because the signs of heart disease would happen actually when the blockages in the arteries of the heart have reached more than 70%. You may have breathlessness on exertion, chest heaviness on exertion, or radiant to arms, but it happens when you walk, and when you rest, it becomes all right. The other thing is even palpitations, fast palpitations of fainting or dizziness. All these could be signs of heart disease, but unfortunately they happen to be too late when the blockages have already reached to beyond 70%. So we should not wait for those signs and symptoms to happen. What are the early indicators? Yes, if you are turning obese, you are having intolerance to exercise, you are finding fatigability or breathlessness, that means you are heading towards development of blockages and you should get yourself evaluated and corrected. Well, if you have certain issues which make you incapacitated, that means whenever you do exercise or walk a certain distance, you are discomforted by either chest heaviness or arm pain or jaw pain or epigastric heaviness, or for that matter breathlessness or suffocation. These are signs, telltale signs. Please consult to the doctor immediately. But I would say, if you belong to a family of young heart disease patients or early diabetes, if you have diabetes or if you are noted to be having hypertension or you are turning obese, at that time you should definitely touch base with a cardiologist. In my clinical practice, what I have been telling about, being Indian already gives you almost 3 times higher risk of having heart disease as compared to Western population. So in my general principle, it is important to get your risk factors assessed as early as 35 years if you are male, specifically even earlier if your family history is bad, and 40 years if you are female, specifically earlier if your family history is bad. So these risk factors sometimes are silent and you come to know nothing about them until they are evaluated.